welcome back for another fun episode of Thrive Live. Today we have guest speaker, Dr. Christina Campbell, who is the owner and founder of the Institute for Functional Regenerative Medicine and Naturally Free from IBD. As a board-certified doctor of osteopathic medicine, she understands that all aspects of our lives impact our health and vice versa. A true believer in lifestyle and functional medicine, she is passionate about health and wellness through natural and non-toxic therapies. A practicing physician for 23 plus years, she has seen what works and what does not. She is endlessly amazed by the incredible beauty of how our human body is intimately connected with the physics and biochemistry provided by nature. So thank you so much for coming. We're very excited to have you on today to talk about irritable bowel disease and how we can stop and just kind of change our approach with autoimmune digestive disorders.
Yeah, absolutely. Thank you so much for having me. I'm excited to be here.
Awesome. So let's get into it. So, let's kind of start with talking about the issues that we see with irritable bowel disease, Crohn's, ulcerative colitis.
Yeah, absolutely. So, you're asking me as far as the disease process goes, like the symptomatology, is that what you're asking? Or
yeah, you know what? Let's start with the symptomatology and then we'll go into kind of the approach. I think that's like a better segue.
Yeah. So, IBD is one of those autoimmune diseases that is, it's essentially where the body creates antibodies to itself, to its own GI tract. But it doesn't stop there, really. It can go you can have joint issues with it. A lot of people who suffer from inflammatory bowel disease also have eye issues. So you get a uveitis sometimes that can affect your ability to see, and sacroiliitis, and among other things. So it doesn't just affect the GI tract, although that is where most symptoms are, and that's where the biggest issues are. Oftentimes, but it can be a systemic problem as well. And I don't think a lot of people realize that.
Yeah.
Yeah.
Yeah, I think I see a similar thing with thyroiditis, Hashimoto's, right? The autoimmune system has become active, and it can go anywhere and everywhere in the body.
Right.
So
which is really a symptom of the immune system being out of control. And usually comes right back to the gut, usually comes back to a leaky gut, as I'm sure you know.
Oh, yes.
And we can talk a little bit about why that is. It really comes down to, the gut lining is supposed to be a solid cells together, super close together with the tight junctions, very close together. It should look like this. Many of us are walking around with our gut cells looking like this, with this big hole in the middle. And what happens when that happens is proteins get across that pathway when they're not supposed to. So things that aren't supposed to go across there start coming across. And because the immune system is not used to seeing those things and shouldn't see those things, it kind of freaks out because it thinks it's under attack. And, it creates an inflammatory cascade that creates inflammation in the entire body, including the gut. And then from there, as it progresses, if it's not addressed early on, you can start developing antibodies to your own tissue. And it's the same process with thyroid disease as it is with IBD, which is kind of the interesting piece, right? That conventional medicine hasn't quite figured out yet. But when you talk about autoimmune disease, it almost always there's a gut issue. There's a piece of it that has to be there. There can be other root causes too, that can be some of the instigating factor. But the gut is almost always involved when it's autoimmune disease.
Yeah, the gut is foundation for so much because this is where we assimilate and absorb our nutrients. 70% of our immune system is there, 80% of our serotonin. So this gut is a foundation. So then let's talk about why we want to take a different approach to IBD.
Yeah, absolutely. Well, with inflammatory bowel disease, the conventional approach is diagnosis by scope most of the time. There are some blood markers now that there weren't in the past. So there are some blood markers that can be tested for that, much like lupus, there are certain types of changes that can indicate it could be Crohn's or ulcerative colitis, but I think still the gold standard is an endoscopy, colonoscopy, where they take a scope and they actually directly look at the intestinal lining and biopsy. And that in itself, the process of doing the scope in itself can create leaky gut, which is kind of, you kind of chase your tail, no pun intended. As far as the conventional approach, most people are getting put right on biologics now. I mean, we skip right over mesalamine and some of the other medications that have been on the market for a long time and have a long proven history of, decreasing inflammation, and I won't say reversing, but covering up the symptoms at least. But now it seems like what I'm seeing is more people, as soon as they're diagnosed, they're told to get on Humira or one of the other biologics that really is, it's not an innocent medication. I mean, its impact on the immune system is widespread and profound. And it would not be a medication I would want to be on if I could avoid it. Right. And then
Can I pause you for a minute?
For sure.
Let's go more into the concerns with the biologics in terms of for more of like the common for the common patient, right? Why is the biologics more concerned for the greater immune system? What would they experience?
Well, anytime you're suppressing the immune system on a widespread thing like that, then you're essentially taking away your ability to fight off infections, right? And in this day and age, obviously, we need our immune system to be working on that, right? I mean, we're sitting in the middle of supposedly in the middle of a pandemic still. And although I will tell you, I don't think this virus is going anywhere, and that's a whole nother conversation. Coronaviruses aren't going anywhere, and they can name it whatever they want.
Yep.
They can give it any variant name.
Yes.
There's probably more than one variant, and that's anyway. But we need to be able to fight those things off. And, it's fall, it's common cold season, another coronavirus, mind you. It's everything and anything that we're impacted, that our immune system's job is to protect us from the outside, right? From the invaders, the things that can cause problems. And if it's not working correctly, then it can't do that for us.
Yeah.
It's as simple as that. And I hope that's layman's terms enough. I think it is.
Perfect. I just wanted to pause you for a minute and just make that,
perfectly
because clear. I think you did an amazing job of just kind of boiling it down to the basics. So, okay, keep going with it. Sorry if I disrupted you.
No, it's okay. No, it's okay. But, and you make a really good point. I'm glad you stopped me because, there's so many things that can be done from a natural perspective that can begin to reverse some of these symptoms for you. And the point of putting someone on this medication is to suppress the immune system so that it stops attacking its own body, right? That's the conventional medicine way of thinking is, let's stop the immune system from working so that it can't keep attacking us. And on some level, it seems to make sense. But the problem is you never are answering the question, what got the immune system doing that to begin with? And why aren't we addressing that? Like, maybe we put someone on a medication that's helping them with their symptoms immediately. Okay, I can deal with that. That's okay. But we need to still be asking the question, what got us here to begin with? And how can we reverse that, right? What can we do to take our body back to when we were healthy? And there's so many things, as you know, there's so many things that we can do for ourselves. And unfortunately, when you're watching TV and you're listening to, what they want you to hear, what's out there, what is being kind of told to you is, well, your life is wonderful if you take medications and, eat your fast food and stop and get, like if you just the series of commercials between a program, right in the middle of a program is, I would argue with every single one of them. My husband goes crazy when we watch TV together because I can't stand it. I have to fast. I'm like, we have to record it so I can fast forward because I can't even.
Yeah. Yeah. Well,
I know it's all a lie.
You never see the commercial about, go find your root cause, because otherwise the disease that's currently creating your IBD, if you don't address it, it's going to be worse in 10 years. You don't see the commercial on that.
Right. If you have one autoimmune disease and you don't fix the underlying problem, you're going to get another one. And, it's funny. I've been practicing medicine for 23 years. I don't like to count beyond that. So I'm actually close to 25 now, but I'm at 23 plus is enough, right? I kind of was laughing when you were reading, and I'm like, that is kind of funny that I have that there. But I'm practicing medicine a long time. And when I was first diagnosed, personally, I have Crohn's disease myself. That was part of how I got into medicine to begin with. And, back then there were 2 medications on the market. One of them was sulfa based and one was steroids, and that was it. That's all they had. And, steroids they can save your life in a pinch, right? But they are not great on your immune system or any other part of your body either, for this, same reasons. And, again, but back then, really, you didn't have people getting 2 and 3 and 4 autoimmune diseases right away. So there's other things going on that we're doing in our environment, and other root causes that are going on that are part of the problem too. And I think if we can tease those out and figure out what is happening with a particular person, and then try and address that in whatever way we need to do, I think that's going to be a much better solution, right? Because then you can start reversing the problem and allowing your body to heal itself. The body has amazing processes in place on purpose to keep us healthy and strong. And if we work with those processes, then we can really be much healthier than we are. But when we just cover up the symptoms with a pill, or whatever, covering up the symptoms, it's great not to have the symptoms. So I get it. But at the same time, you really have to get to the root cause, as you pointed out. So.
Yeah. Yep. And, I know a lot of the root causes, but just for our listeners, let's hear from your perspective. What are some of the big root causes that you see with patients that are really key at driving this autoimmune process or activating it?
Yeah. So, as we said, gut health is a huge piece of it. A leaky gut is really the problem when you're talking about autoimmunity. But sometimes there can be things that are causing that leaky gut, right? So environmental toxins are a big piece of it. What we're eating in our diet, glyphosate is a huge problem. So when we talk about what we're eating and chemical exposures, Roundup has really done some really unfortunate things for people. And it in itself can cause a leaky gut. Stress can cause a leaky gut. So, if you're a high powered, employed person who is, go, 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 and in a high stress environment, that can cause a leaky gut all by itself, due to the connection between the brain and the vagus nerve that innervates, everything. It's kind of like the telephone to all the different places in the body, where the conversation between the brain and the body goes on. That's how I think about the vagus nerve, and it'll tell the body, that brain, what's going on in the brain can impact the body through the same nerve. So, so toxins are almost always a huge piece of the puzzle. What we're eating, when you're eating fast food 2 and 3 times a week, it's not real food. And it's funny, I tell my kids all the time, look, if the food can sit on the shelf for 2 weeks, it's not food. It's just not. Obviously you can have things that are canned and you can have dried foods, and that's a totally different thing. But essentially the processed foods, things in bags and boxes, those things are not serving us well. And it's, a lot of times that can be part of the problem. Lyme's disease is a huge piece of it for many people. It's an epidemic and people don't realize it. Conventional medicine isn't recognizing it. A lot of the tests don't pick it up. Nothing the insurance will pay for will pick it up. Unless you're just really lucky and you happen to do the test at just the right moment. And, and everyone thinks, well, you get a rash from it, but you don't always. So I see a lot more people than I anticipated, are coming back positive for Lyme or other tick-borne illnesses. So that
and I'll confirm with that too. I've been shocked on how, when I kind of really started getting into more of these deeper root cause layers and realizing, oh my gosh, I have so many patients with Lyme and chronic Lyme and undiagnosed Lyme. And we realize it's not just the tick we get from bed mites. We can get it from fleas. Now the research shows that it's way beyond the tick. And
right.
And it creates that autoimmune cascade.
Right. Exactly. I mean, you can get ticks from walking in the woods. You don't have to be near the deer, it's not, I mean, they happen to live on the deer. That's how they got the name, but they're everywhere. They're everywhere, and they'll come in on your animals. If you have animals that come in and out of the house, they bring that in. Other root causes I see a lot with women who are on birth control pills for long periods of time. That in itself can create a leaky gut. Just the hormones themselves can create that problem.
Mm-hmm.
What else do I see? I mean, I think, there's usually more than one thing going on with a person. I mean, by the time they're diagnosed, and you can, as you pointed out, it's almost like peeling an onion, right? Like you start with the leaky gut and you try to fix that, but then what caused that, right? So then you have to figure out what caused the leaky gut, and then you need to address that. When we talk about autoimmunity, there's a significant relationship between, adverse childhood events, which is a very nice way of saying you had a traumatic childhood. And a lot of or perceived traumatic childhood. That's the other thing, is it's not just that it was traumatic, it's that you perceived it to be. So maybe it wasn't that bad, but you thought it was, right? As a kid, it was for you. And that stress in itself can cause, progression to autoimmunity. There's a really great study out there that shows a direct correlation, which is pretty impressive.
Yeah.
So, I mean,
and if anyone wants to take it, I think it's the ACE score. You can Google it, and you can take your own childhood, get your own ACE score, and see how it comes up.
Yeah, and what it might mean for you. And that doesn't mean you're guaranteed to have an autoimmune disease if your ACE score is high, if you get right on it now, right? There are things you can do that can, prevent those things if you're not there yet. And oftentimes I find that, people have had the symptoms a long time. I mean, by the time you're diagnosed, you've had this problem brewing for many years, decades even, for some people. And, at any one of those points, if they'd have realized that they were, that there was something they could turn around, you can make a lot of impact before the diagnosis. And in conventional medicine would have you believe that once you're diagnosed, you're always going to have this problem. It's like magic. They couldn't figure it out for 5 years, but now that they have a name, you're going to have it forever. Well, that doesn't make any sense. Right? I mean, why am I gonna? No.
It goes back to addressing these root causes like you've been talking about. And, we can't change what genetics people have, but we can change their expression by addressing these root layers.
That's right. That's exactly right. The reality is really in epigenetics, where genetics and environment come together, right? What you're doing in your environment, chemical exposure you have, how you're eating, how your lifestyle is. And lifestyle is a big piece of it. And that's the good news, right? The good news is that lifestyle changes in itself can be a big piece of fixing the problem if you know what your problems, what you have going on going into it.
Yeah, which is pretty amazing. The body wants to heal. We just have to kick out those roadblocks, identify them,
right,
and then break down those roadblocks. And the body wants to heal. It has the capacity. It's amazing.
Yes, that's right. And with the right guidance, and really, that's what functional medicine and lifestyle medicine, integrative medicine. I mean, that's where a lot of us are. Naturopathy. I mean, a lot of us are trying to do that, right? Trying to help people figure out what their root cause is and go after it, and address it, change it. And it doesn't all have to be done at once. If you're diagnosed when you're 40 years old, it took you 40 years to get there, right? So, you start making changes to kind of unwind those things. But a lot of times we have that fast food personality in this country now, or, medication personality. I take the medicine, I feel better. That's great. But when you start working on underlying root causes, it takes a little bit longer because it took a while to get here. It takes your body some time to naturally, wind that backwards. And I find that people have a tendency to get a little bit frustrated when they don't get immediate results, with one thing or another. And, I guess my message there would be, there's a lot of hope, and everyone should know that there's a way to get there. It's just a matter of figuring out what needs to be done, and then, being willing to do it.
And it's also going to take time to
Yep.
people time for the symptoms to come up and time for the glycophosphate to come in and to be on that birth control. And so it's going to take time to reset the systems.
Yeah. Yep.
So let's talk about the insurance issue, because this is, a big one when it comes to naturopathic medicine, functional medicine. Insurance does not want to pay out. They got closed pockets when it comes to us. And so let's talk about the big insurance issue. And
yeah, so I mean, it's an industrial medical complex, right?
Mhm.
I mean, it's pervasive, and it's a relationship between insurance companies, pharmaceutical companies, and the hospitals, frankly, and medical testing. And they tell physicians, the insurance companies will tell you as a physician what you can and cannot do for a patient, what medication you can and can't use, what testing you can and can't do. And I'm not really sure where and when exactly physicians gave up their ownership of their own practices, but it has, I think it was kind of an insidious process that happened slowly over many, many years. But physicians don't own their own practices anymore. It's all really owned by the system. And a lot of physicians are frustrated with that. You get paid for 7 minutes with a patient. So of course you can't find out everything. How can you learn about a person's root cause when you barely have time to sit down? Never mind actually have a conversation, right? And that's what patients get upset about that too. Doctors are not happy about it either. They don't want to see 55 people in a day just to get paid, what their time feels like it should be worth in order to put food on the table for their families. And, they want to take time. They want to see their patients progress and get better. But unfortunately, the conventional system really has not, it doesn't allow that process to be healthy. And physicians get sick and stressed and tired too, and burned out, because they're expected to do all of these things that don't really make sense to me anymore. I worked in that world for a very long time, and I think part of the reason I was in the ER was, I was in a residency with internal medicine and emergency medicine residency. I did a dual residency. And when I was in the internal medicine clinics at the time, I loved my patients. I loved being in the clinic. I loved having that interaction, but nobody ever got better. They never got better. And that frustrated me to the point where I just said, that's it. I'm done. I'm out. I'll be in the ER saving lives, and that'll be okay. But even there, the chronic illness side of the ER, where people, they're just sick all the time. They're always coming back. Their medication list gets longer and longer. 25 medications, 30 medications is not unseen or unheard of. And, clearly that is not healthy for us. And that's kind of just the way it's all set up, right? And you can have a conversation with a patient in the ER, and you can suggest taking away a medication, but the primary tends to put it right back on when they get back to the office, and you just spinning your wheels, going in circles, and no one ever seems to get better. And no wonder, right? Because we never, I was talking to one of my patients today who was diagnosed a few months ago, and she's an inflammatory bowel disease patient, and she said, well, what can I do with my diet that will help me? The doctor said, it has nothing to do with what you eat. Eat whatever you want, whatever you can keep down. And that's the conventional wisdom, which, does that even make any sense? It doesn't make sense to most patients, right? It certainly doesn't make sense to me. And, anyway, I could go on and on. And I could go on forever. On both sides of the fence. And, meanwhile, there are physicians who are, they're sick because of this stressful environment they've been practicing in. And you can't take care of people in 15 minutes. My average appointment time is an hour and a half, and that's the way I want it to be. I want to know who my patients are and what they do and what their worries are. And I want to have that conversation. I want to be able to help them on a personal level. And I want it to be, really what they need. I want to know what's happening, right? Like, what's happening with them. You can't find that out in 15 minutes. Certainly not in 7 minutes on the follow-up visit,
No.
You just, no.
Yeah. And then also issue with insurance is they don't tend to pay for all of the preventative labs that we want to test in for the glycophosphate, the mold, the organic acids, the genetics, the leaky gut markers. They don't want to pay for that.
Right.
But that's the information that we need to help identify those root layers. And so it's kind of
Right.
where, unfortunately, patients are stuck in this position of, well, they're paying up the arm and the leg for this insurance. It's not going to pay for the testing and diagnostics that we need. But then yet there's so much value in investing in those diagnostics, because you look, it's not just the cost of treatment. You look at the cost of what if my Crohn's disease, ulcerative colitis progresses because I can't get to the root cause? How does that look in 20 years, 15 years?
Right.
Right. What is the cost? How is that affecting your life, your energy, your ability to work, your ability to connect with your family? All of the more the indirect costs per se of disease.
Which is really one of the biggest pain points, right? I mean, because you never get better. You never feel great. You have days that are better than others, but you never really feel great. And when you feel like that, you have no energy, you're exhausted, you're in pain all the time. I mean, how can you work well, right? So you lose time you lose income to sick days. Sometimes you lose your job because of it. And it's awful. It's awful. I think it's one of the biggest pieces of the puzzle that's really just difficult. And once you get to the point where you're so bad you can't work, now you're on, now you're at home on essentially on disability, right? And with no hope in sight, because conventional medicine offers you nothing but another pill, or God forbid, let's just take your colon out and see if that works. Let's take the whole thing out, right. And I get that can be life-saving in some situations. Don't get me wrong, but the frustrating part about that is that, there's so many things that can be done to reverse this process and maybe perhaps avoid the surgery, but it's become conventional medicine. It's become standard of care almost. And when you talk to people who've had Crohn's for more than 10 years, a lot of them have had a colostomy. Sometimes they've had a colostomy and an ileostomy. Sometimes they've had, feeding tubes. I mean, just G tube, tubes everywhere, right? And that once you've gone down that, what can you do then, right? Now you have you can't reverse it. You can't put the colon back in. So it's kind of like, it's frustrating to me. And, and this is no comments on the patients, obviously, it's a comment on the system and what we're missing and what we're not doing well, and what we could really be doing better. There's some really great research on inflammatory bowel disease and the indirect costs that you mentioned. And in putting all the numbers together for a talk I was giving, it turns out that most people with IBD will spend $10,000 to $25,000 a year out of pocket. Copays and medications that aren't covered and this, that, and the other thing. And that's a lot of money. So you think about over a decade, that's $250,000 that goes out of your pocket to pay for this chronic illness that there's no solution for.
Right.
In conventional medicine, mind you. And so wouldn't you rather pay? I mean, I can tell you honestly, I would have paid everything I had to find out what I know now when I was diagnosed at the age of 12. It would have changed my life, my whole life. I mean, there are moments that I missed in my life because I couldn't get out of bed that I'm still sad and regretful over. There's nothing I could have done about it, of course, but from being a bridesmaid, and not being able to show up, I got there. I was at the hotel, but then I'm so sick because the food, I couldn't make it to all the activities, things like that just, you can't get that time back with your friends. You can't get that time back. You can't get the money back. You can't get the copays back. There's so much that, and that's just the loss of what we call chronic disease, right? Those are the things that we deal with. And once you have one, you're bound to have another and another and another. And really, because you still haven't addressed the root cause. And it always comes back to that. Get to the bottom of what's really caused the problem to begin with and address that. And a lot of this other stuff will fall away.
Yep. Yeah. I mean, I've always kind of been a big believer in a time and place for everything, right? Sometimes we need that higher intervention just because inflammation is unchecked and we just need couple days of a
Absolutely.
steroid, right? To buy the time so we can dig into the root cause, so the patient isn't just suffering over the pain, because the root cause is going to take time. But I 100% agree with everything that you said. But unfortunately, I think we're failing patients in the medical society by not digging as a collective unit into the root cause layers. And unfortunately, only just, part of our medical society is. And by just palliating the inflammation, palliating the pain, is going to have all these further developments into the disease process. The autoimmune system goes elsewhere. And there's this huge other financial cost to the disease that is beyond just the medical costs.
Absolutely. Absolutely. Yeah.
Yeah. So hopefully,
and you're absolutely right. I mean,
will...
medications can save your life. They can. They absolutely can. And there is a place for that. But there is, and that's part of why I was satisfied with working in the emergency department as long as I did. That was where I could use medicines to save someone's life, right? I mean, but when it comes to chronic illness, you save their life, but then you got to fix the problem, right? And it's kind of like you're pouring oil into the oil tank, right, to keep your car running, but you never fix the hole in the tank, right? So you're pouring it in, that's great, but it's still falling out the bottom, right? So you're not really getting very far. So you have to solve the problem, fill the holes, figure out where the gaps are, and fix it. And yeah.
Yep.
And unfortunately, there are more and more, and I'm really grateful for that. I'm truly grateful for functional medicine and what some of the like IFM and some of the other groups are doing. And I'm grateful that so many people have figured this out and are jumping on board, different types of practitioners, naturopaths, DOs, MDs, people who have realized, and usually it comes with this story, right? They got sick and they couldn't no one could offer them any help, and they weren't going to accept that. And that's where they figure out that, hey, there's this whole other place where people can give me answers and I can make choices and and I think as a patient, one of the things, you want to do something to fix it, especially early on when you're first diagnosed. You're just like, well, what can I do? And you can say that to your doctor and they're going to say, well, here's your pill. And they're not going to give you a lot else because they don't know. And it's not because they don't care about you or they don't want to, or they're hiding the information. That's not true. They're just not educated. They don't know what they don't know. And they don't have answers. And, we have answers over here. We have some things that we can offer that conventional medicine hasn't figured out yet, unfortunately. But hopefully, with time and more research, we'll get there.
Yeah.
So, and to your point with labs, I was reading a study that showed that, the single independent risk factor for type 2 diabetes is an LPS level. And of course, lipopolysaccharide, or LPS, it comes from leaky gut, right? The more of it you have, the higher your chance of getting diabetes is. And that's the basics of it. But you can't get a conventional test done. And yet the leading cause of death, period, for all people everywhere is still cardiovascular disease. And diabetes is the major risk factor for it. So we have answers. The research is there. It's just that, there's not the push.
The research on LPS has, I feel like, really blown up in the last 3 years, especially. I mean, you just, Google Scholar, like LPS and cardiovascular disease, LPS and stroke, LPS and dementia, and LPS starts in the gut. And so gut is the foundation that kicks off this cascade for chronic disease that conventional medicine, I guess, approach per se, might not pick up until we have that stroke, until the dementia is onset 50 years later, or we have that heart attack, and we're diagnosing things way too late at that point, unfortunately.
Right. Exactly. If you're already having the heart attack, like we missed our boat, right? We missed the opportunity. Yeah. And granted, ER to stent placement in 20 minutes, that happens in this country. We're in an ER that was probably, if I ever have a heart attack, that's where I want to be when it happens, because you're in the ER for 3 minutes or 5 minutes. I mean, it's literally like boom, 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 boom. Everyone, IVs, medications, stabilize to the cath lab. And it's incredible. But we don't want to do that, right? We don't want to have to do that if we can prevent that situation, right? Why have the scary situation if we can figure out how to prevent that? And just for the people who are listening, who may not know the details of what LPS is and where it comes from, it's actually created by the bacteria, the microbiome, the bacteria and the little bugs that are supposed to be living inside of us that we actually have a symbiotic relationship with. When we have the right microbiome and we're in balance, it all works great for us. Interestingly enough, there's actually bacteria that when mom is pregnant, that actually is what develops baby's fetus. The fetus's brain, right? So brain development is because of our microbiome and having the right one going on. So, I mean, it's incredible. The symbiotic relationship, we have to have the right bugs there. We have to stop killing them all. And, with overuse of antibiotics, with hormone replacement, or I won't say hormone replacement, I'll say birth control pills, because bioidenticals are a whole nother animal. LPS basically is a chemical that's released by the microbiome, by the bacteria, that's not supposed to get into our bloodstream because our cells are supposed to be close enough together to block it from getting into our bloodstream. But once they're open enough that this can get across, that's where, and so the further open, the more LPS gets in, the leakier our gut is. That's kind of why this is an indicator you can test for. So hopefully that will make sense to most people who are listening here.
Yeah, perfect. I love it. You're really good at breaking down and explaining just the medical pathway. I love it. It's awesome.
Thank you.
And as a note, if anyone has any questions, feel free to send it over in the chat. I always like to try and keep these more around 30 to 40 minutes so that it's doable and listenable, and we can listen when we're driving or whatever we're doing, right?
Absolutely.
Are there anything that we missed that you want to make sure that, you convey out to our listeners?
One of the things we haven't touched on, which I think is a really important piece of the chronic disease or the chronic illness model in conventional medicine is, a lot of people get to the place where they embrace their disease as a part of themselves. And I see that a lot with Crohn's and ulcerative colitis patients, proud of their disease, embracing it. It's, and I'm not saying don't be proud, but what I want to see more of, what I think would be a healthier approach would be, proud and in love with yourself, who you are, but not necessarily owning your disease, because you don't have to do that. It doesn't have to be the way the rest of your life is. And when you are able to conquer it, you don't need to go through an identity crisis, because now you don't have that identity, right, anymore. So rather than making the chronic disease part of your identity, it may be something you're struggling with, and that's okay. And it may be part of what you're going through right now, and that's okay. But understanding that it does not need to be the way that your life is from here on out. While conventional doctors will tell you that the day that they diagnose you, and I'll never forget that conversation that I had with my doctor. I mean, he sat down, I was 12, for heaven's sakes. You're going to have this forever. You'll be on medications forever. You probably won't be able to have children. You probably won't be able to, I know you have dreams of going to medical school. You're probably not going to be able to do that. You're probably not this. You're probably not that. I mean, by the time he was done, I wanted to shoot myself,
Yeah.
But I mean, and who are you to profess that on me, right? To speak that on me. And I would rather I have a physician that was going to speak life to me. Speak life to me. Don't tell me what I can do, what I'm going to succeed at, what I have opportunities I have, rather than all these things I'm never going to be able to do, which I saw. Luckily, I was able to see through as a sassy young girl like I was. But, a lot of people don't see through that, and they embrace that as, okay, this is the way it is. And now, because I need people to understand these things I'm going through, I embrace it so much as part of my identity that this is what I talk about all the time. And it just doesn't have to be that way. And I hope that I'm making sense. And I don't mean to be insulting to anyone, of course. And I completely understand needing people to understand what you're going through. I just don't want you to own it like it's never going to change, because that is the surest way to never changing.
I think that's so important because I see that. I mean, I see that throughout just patients all the time, with fibromyalgia, Lyme disease, Epstein-Barr, where, it's easy. It kind of gives this pride of like, oh yeah, I'm fighting this, I own it. But we also need to be very conscious of, we have to be able to release that.
Exactly. And, I went through that myself. I used to call it my Crohn's disease, right? My Crohn's, my migraines. And at some point, one of my friends, and I was really grateful that she pointed out to me, I didn't even realize it. And she said, I feel like you should not be saying my. Why are you owning it?
Yeah.
And I didn't know what she was talking about at the time. It took me a while to really understand that. But she was right? Because when you say it's yours, it becomes yours. You're essentially telling yourself and your subconscious that it's yours. Your body listens to you, and your brain is a powerful thing. And what you believe in your mindset has a big to do with how you actually end up. And, there's a lot of research on that with cancer research and oncology patients. The ones who do better and the ones who are, survivors are ones who have good mindsets that don't embrace it as, as mine.
Mm-hmm. Yep. Be open to change.
Yes.
Yes.
Right. And, who you are as a human being, as a person that, was put here on earth to do amazing things. You should own you, like all the amazing parts of you, but don't own the disease, because it doesn't need to be that way. It doesn't have to be that way. Your life doesn't have to be that way forever. There is hope, right? And there is a way to change that for yourself. But you got to ask the right questions and find the right people, and you have to be an advocate for yourself.
Yeah. I think that's actually a beautiful way to end, is owning the beauty within us and not our disease. I love that. I'm just going to end on that. Thank you so much for coming. This is amazing. My vision with Thrive Live is to be able to have these open, candid discussions with providers across the medical spectrum, to be cracking open our approach and the vision of health, and because if we can get patients and people to be asking their doctors for, okay, well, why are you giving me this? What's beyond this? Why is it causing that? Then we can have this ripple effect within the greater medical society, and patients will be getting better care, and they can be asking the right questions, and they're going to feel empowered with their health. So thank you so much wholeheartedly. You were an amazing guest speaker.
Oh, thank you. I enjoy this. I feel like we really need a revolution in medicine. We need to change our approach to chronic disease. We do the other things really well. We do acute disease. We do emergencies. We do trauma. We do those things really well here. And all due respect, I mean, really well. But we've got things to work on in these other arenas, and it is really important to push back, and it's important to find answers for yourself. And if you're not satisfied with what your doctor says to you, go ask somebody else. There are hundreds and thousands of us out here, and there are people who are willing to answer your questions on a more personal, precision, personalized medicine. That's really where it's at. There are people here who can help you with that.
Yep. And for those who are listening who are struggling with Crohn's disease, ulcerative colitis, irritable bowel disease, I will have Dr. Christina's information at the end, but also you can find her at drchristinacampbell.com, Instagram, Dr. Campbell. And she has a fantastic approach with IBD patients. She is a wealth of information and a fantastic resource. So if you're struggling with IBD, definitely reach out to her.
Thank you. And just, I am working on a new website that I'm putting together for IBD patients. It's going to be called naturallyfreefromibd.com. And it's in progress, but my goal is to have it be a wealth of knowledge and resources for anyone who's suffering from IBD. Things different methods and tips and tricks and places to connect. So I'm hoping that it'll be a place that you can go to really get the information that you need to get better. So I'm working on it. It's a work in progress, but I do want to throw it out there so you guys can be looking for it.
Fantastic. I'll put that in the closing window too, so that whoever looks at this video in a month from now and your website is up, they have the direct link. Yes.
Perfect.
All
Thank
right.
you.
Thank you so much for coming. It was a pleasure. And everyone have a wonderful weekend, and we will see you next week for next week's episode.
Awesome. Thank you.
You're welcome. Thank you. All right. Bye.
Bye.